Good.
Good.
Folks, good afternoon. This is County Executive Mark Molinaro, and we're coming to you live from the county offices. Wanted to take some time again today to update you on both coronavirus response here in Dutchess County, some of the data that we're dealing with, and of course some of the response. So we're live on Facebook. I am told today that in fact Netflix might be down. I don't know if Amazon Prime is down, but in theory, we might be the only thing on to watch. So we welcome you to Facebook. I apologize if I'm a little bit late, but want to just also advise you that it's possible that Facebook Live might experience some technical difficulties. There's been obviously an overload as folks are home. Making use of live streaming, video streaming and live technology, both through Facebook and others. So we're happy to have you here. We're going to spend about an hour together talking a little bit about what's going on here in Dutchess County and beyond. I have to tell you that I have to share the post on my personal page, and so I'm going to do that as we also get you updated. But welcome to what is this live town hall. I want to give you some basic information regarding data points now in Dutchess. So first, and we know this number, one is going to consistently grow, and two is not a reflection of the total number of individuals in Dutchess County or New York State living with COVID-19 coronavirus. But as of this morning, Dutchess County has 124 identified confirmed cases. And this is a good reminder that these are individuals, humans, neighbors, friends, family who are living with this novel coronavirus. So 124 people in Dutchess County confirmed positive. Currently, there are 377 individuals in Dutchess County that are under mandatory quarantine, and we can talk a little bit about what that means. We have tested at our Nuvance and Pulse MD sites. These are the mobile locations. 218 tests since we initiated those mobile testing sites on Monday of this week. Sadly, on Saturday we reported, and you may know, Dutchess County did have our first coronavirus-related death. A 69-year-old man who had not been confirmed positive and was not under any local medical monitoring came to a local hospital and ultimately succumbed to the virus. This is so those are Dutchess County's numbers. I think you likely know that New York State is basically the epicenter in America of the coronavirus epidemic, with nearly 31,000 individuals now confirmed cases in New York State. Some 3,600 New Yorkers are being hospitalized as we speak, and 285 deaths in individuals who have succumbed to the virus here in the state of New York. So there's a lot that we want to try to cover today, and we have some questions. So my wife, Corinne, is going to be very proud of me. The only people at this desk are me and my friends who are helping us communicate. We are 6 feet apart. The reason I say that, of course, is that we are all trying to help to flatten the curve and lower the transmission rates. And of course, as you know, the term social distancing. I'd rather us call it physical distancing, but the goal, of course, is to keep and slow the transmission. So I am going to attempt to operate and respond to questions as they come up on Facebook and keep tabs on my phone as well. But we did have one question come in so far, or several questions. So if you have a question, add that to the comments, and they'll keep popping up on the screen for me to get to. So one of the questions from Rosie was, should people be traveling to their vacation homes right now? First of all, people should pick a home and hunker down in it. meaning that there are plenty of people, certainly from outside of our area, that have second homes here or maybe part-time residences. And our position is, if that is your home, you should call it your home and you should stay in your home. And that is the same for really everyone. And I know that we see this driving to and from place to place. Listen, the goal overall is to stay in place, stay at home, stay near home, as much as you can. Obviously, getting to the grocery store or dealing with some certain necessities are important, or is important, but the goal is to not transmit the disease. So what I also would offer to you is that we are discouraging people from taking up short-term residence. Short-term rentals, use of the hotels and motels, except for healthcare professionals or those who might be, in essence, stranded and can't get back to a location, is what is appropriate. But taking up short-term residence just isn't. So whether you're from New York City or Westchester or Dutchess County, the message from the governor on down, and we concur with this, is to stay in place. If you've contracted the disease, it is best that you first triage for yourself, meaning if there are light symptoms and these are not severe, you're likely to weather this if you are not a higher risk individual. So staying in place will allow you to make those sort of decisions locally, at the same time diminish the ability to transmit the disease, and that's really what we're encouraging folks to do. Another question is, many people I know want to help our community during this time. What can we do? I do think that is a strong message that we can offer. Listen, this is absolutely unprecedented. These are unprecedented times. These are uncharted waters. We're up against sort of in a battle that we don't and can't see the enemy. It is a disease that that many people are living with, and sadly, as we know, those who are higher risk are or at least have risk of severe symptoms, and sadly, this disease can be fatal. With that and the decisions made by both the local government, state government, federal government, to reduce the amount of folks coming to and from work, the stay in place instructions, the devastation is great, and the challenge is going to be overwhelming. Dutchess County launched Dutchess Responds. This is a coordinated effort among our not-for-profit community in Dutchess County. If you visit dutchessny.gov, and visit Dutchess Responds on that website, you'll be given an opportunity to donate money if you have it. We're already in the process of raising money. We're grateful to some residents in the town of Amenia from in around Silo Ridge, helping us raise $500,000. If you have the ability to donate, those funds will go to purchase food and products to help people who are either isolated, shut in at home, or dealing with the disease themselves. We have opportunities for volunteers. We need folks to distribute food to pantries, to distribute from pantries to individuals who are shut in, and there's ways to do that safely. If you are looking for a location that is distributing food, or a community that's doing some sort of outreach activity, you'll see that at dutchessny.gov at the Dutchess Responds page, if you will, on dutchessny.gov. So there are plenty of opportunities, and those are just the ones Dutchess County is coordinating. You likely know that we converted our temporary housing units at the county jail to a 24/7 shelter facility. So there's opportunities, not necessarily for you to appear and volunteer, because we want folks to be safe, but there are volunteer opportunities that you can be trained and participate in. If you'd like to volunteer, again, visit dutchessny.gov. Visit the Dutchess Responds tab at dutchessny.gov, and you'll be given that opportunity. If you have a medical background and you'd like to participate in the Medical Reserve Corps, there's opportunities for that, and you can volunteer again at dutchessny.gov. Additionally, I would offer you that we're taking volunteers at our call center. We're operating a full call center at area code 845-486-3555, 845-486-3555, and that's being operated by Medical Reserve Corps and other volunteers, and we certainly could use your help if you're interested in participating in that. You'll get some training. You can actually do this. Excuse me. By the way, this is what we're not supposed to do. So I've got my hand sanitizer. Yeah, I have to be very cautious of that. So if you want to volunteer, you can actually make calls and take calls from home, and there's a process for that too. So 845-486-3555 is the helpline. DuchessNY.gov is the website. Visit there to participate if you'd like to volunteer. Like many of you, my children are home. My wife has, I think, turned the house into a full-time camp. We jokingly call it Camp Corinne. But I know that the challenge of having kids at home is unique for many. We're very fortunate that our school districts have all sort of chipped in. I know that school teachers and others and local libraries are creating programming that you can take advantage of. One of the questions we got is any word on when schools might reopen. We said this when the three counties in the lower Hudson Valley took this action. Orange, Dutchess, and Orange, Dutchess, and Ulster agreed several weeks ago that we should move forward with school closures. We did that. We expected that schools would likely remain closed first until April 1st, which we acted on. The governor's order, which came after our orders, expected that schools would open again on April 1st. I would offer to you that is highly unlikely, and I think the governor has made that clear as well. While a firm date has not been set, I think that when we look at the transmission of cases, we recognize that in particular, the epicenter, New York City, the transmission continues to grow at a staggering pace, and it is creating an overwhelming need for medical care. That is going to continue. This is the curve that they talk about. So as cases continue to be identified, that curve continues to move up. At some point, it will hit the apex, and hopefully through the steps we're taking to minimize the transition, that will peak. The apex meaning the time at which it peaks, and then begins to transition back downward. That wave, if you will, is likely to crest within the next 14 to 21 days. So if you're using that as any indication, the medical professionals, public health professionals will argue that we're looking at another 4 to 8 weeks before we can incrementally begin to return to some semblance of normal. And normal is going to look a lot different after this than before. So I would offer to you that while there is not a firm date, I do believe and would definitely suggest that schools will remain closed through the month of April, with the hopes that there could be some transition back to some school programming after that. But I think that is also optimistic, but no direction yet from Albany or the governor's office. But that's I think a good expectation. The school's not likely to open in the month of April, and hopefully we can begin to transition back to some extent sometime in the month of May. But again, that's optimistic, and it's based on whether or not we're following the rules. There are times that I feel a little bit like we're like the hall monitor. We have to encourage people to stay in order to flatten the curve and lessen the transmission. And I think that will indicate for us when schools can return. So there are a series of questions. I'm going to try to categorize a few. I know a number of questions regarding potential restaurant restrictions beyond what's already in place. Let me try to get through a few of them. Basically, I want to make sure I get these right. So, do we expect any further restrictions on restaurants' ability to provide takeout and delivery? Actually, we don't. I think so. When the counties took action and the governor imposed this stricter, in essence, stay-at-home, or New York pauses, if you will, the need to access food is important. So restaurants are given the capacity and the option to provide curbside and takeout. You'll likely know that. If you have the funds to do so, please support our local businesses. Yesterday, Tuesday, was sort of an experimental effort to encourage takeout. It was Takeout Tuesday, and that was encouraged across the state and the country. If you have the means to do that, please try to support your local restaurants. But they have to continue, as you know, through curbside delivery or takeout. I do not expect that those restrictions will become any greater, because we'll still need them. In some ways, restaurants and grocery stores now are all part of the emergency response. To the extent they can afford to do it and you can afford to pay for it, we need them being able to provide food to families and individuals in need. I would not expect that to change. However, the governor's orders, right, include a list of businesses that are deemed essential. I don't like the term essential versus not essential. That's sort of governmentese. But I think the right answer, or the right description, is necessary versus unnecessary at any given time. That list, if the curve doesn't flatten soon enough, is likely to be reduced. And I would think that over time, if we don't see the plateau and the slowing of the transmission, you might see the list of what's deemed essential shrink a bit. But food service is not going to be one of them, because we need them obviously now perhaps more than ever. So question regarding restaurants. What are the limits on social and community gatherings, and can you go to small parties even at someone's house? Listen, the rule isn't like you're not going to get sick if you're in somebody's house. I mean, understand that the truth of the matter is that social interaction among anybody who has transmitted the disease is likely to, again, spread that transmission. And we don't want people being socially distant, we want them to be physically distant. And that's the language that we use, social distance, but the goal is to keep groups small. Now, the county rule of thumb is smaller than 20 people. But 20 people at my house is not the same as 20 people in 15 acres of parkland. So again, the message is very simple. If you don't have to gather in a group, you shouldn't. And that means even at somebody's house. Now, is that government going to restrict you? No one's come into the house. But I would offer you this. The goal is to slow that transmission. So 2 or 3 people at someone's home, if one's sick, it's likely in close environment, all 3 will transmit the disease. So making the choice to limit that interaction for a short period of time, as challenging and burdensome and anxious as that is really the instruction. We're asking you to take that selfless effort to try to slow the transmission. Just as a reference, in my case, my dad has some underlying health risks. We just chose that we couldn't, of course, have them all over at the house, because we didn't want that to cause a problem for him, nor as you can see, I'm out and back, right, from the office and trying to get some work done on your behalf. I can transmit, right? So the goal is to minimize that transmission, and that means in any setting possible. But for the county's sake, we have asked that social gatherings, community gatherings of 20 or more be suspended, and we're asking you to comply and try to do even more than that. Lots of questions regarding access to personal protective equipment, PPE, we refer to them, medical masks, and other products. First, I'll tell you that there's a shortage. There is a critical shortage. It is sort of what's been so blatantly unveiled in this emergency is that access to this kind of personal protective equipment is limited. Supplies were limited, and the distribution of those supplies and that distribution chain is exceedingly challenged, and you're seeing that all across the country. New York, because of the number of cases, even more so. Medical professionals not having access, certainly those in the healthcare, throughout the health community, not having access. Organizations that care for those with developmental disabilities, child care, daycare, all are really left at the moment not having adequate access. So the first thing I would tell you is, if you're not out and about, and you don't have to be out and about, then the use personally of a medical mask is not necessary. And there are certain protocols and expectations when you actually use these masks. I'm not the physician, so I'm not going to give you that direction. But if you're out and about, obviously you want to try to cover your mouth. Obviously, the simple things like coughing into your elbow. Yes, you can use a scarf or something to cover up if you're out and about, and accessing medical masks as they're available. Useful. The N95s, these are the fitted sort of masks, not necessarily appropriate for average individuals to use, mostly because they should be fitted appropriately. And of course, those N95s are very, very valuable and necessary for medical professionals. So again, staying home is the best option, right? Not taking those steps. If you can, if you have to get to the grocery store, you can use some alternatives to a medical mask. But accessing them is challenging. The governor has made clear that this state needs more. We know locally that we need more. The Dutchess County Department of Emergency Response is charged with sort of making these orders. We have thousands of orders out. We have our commissioner traveling to a space out in a port out in Connecticut, even looking at trying to purchase right off the boat certain equipment. We do think that the federal government needs to take aggressive measures to limit purchasing competition between the states and between the states and the federal government, and then with that, hopefully begin to stockpile and redirect those resources to local communities so that we're not competing with one another. I can tell you that the counties are in the position where we're trying to make purchases both through the state system, and it's been very helpful, but we're also trying to make purchases on the free market, and at times they feel a little bit like, yard sale hunters, looking for, the next good buy, and it's just a very challenging situation for us. So we try not to waste those and obviously direct them to the extent we can to medical professionals, and I can only promise you that we're making purchases every day and distributing them throughout. I'd also ask if you're at home right now and maybe you have a supply of latex gloves or the traditional medical masks that you want to donate. There'll be opportunities this week. We'd like to work to try to get those. Even if they are small supplies, we want to make sure they get to some of the priority servers that we have, like those who care for those for seniors, for at-risk populations, for those with developmental disabilities. So there'll be an opportunity even for you if you're sitting at home, or maybe you have a small business that has even a small supply. If you're not using them, it'll be very helpful. You can visit dutchessny.gov, visit the Dutchess Responds tab at dutchessny.gov, and we'd be happy to accept the donations and put them to work. I'm sorry, that's the way it has to be right now, but the federal government, the state government, local governments are buying what we can and distributing them, and we welcome the donations as well. Question regarding are town governments allowed to monitor, shut down, operating non-essential business? Short answer is yes, they are. The order from the governor is really not that me and the town supervisors should be out issuing tickets or locking doors, but we are asked to use government resources to inform businesses that are not complying with the non-essential order that they ought to. And if they choose not to, then appropriate law enforcement or the public health officers will be notified. And so, yes, municipal governments should be part of the effort to help comply with the instructions. The other is if you are deemed essential, and I know there are a lot of businesses that are, we really need you internally to help us practice this social and physical distancing. I'll just offer to you, if you're hanging out at the Stewart shop and you need to pick up your coffee or your goods for the day, it just is not helpful to you or anyone else to be congregating together. So it is necessary, or any shop, it is necessary to try to engage in that social and physical distancing. We're doing the same thing at county parks, we're doing the same thing in other aspects of our lives. That will help slow the transmission. So whether you're essential or not, helping us in sort of impart and impose these physical distancing, social distancing standards and rules is very helpful. It'll save lives, and it's in the best interest of your health and the health of your neighbors. Let me offer, there's a question, several questions regarding the drive-through testing. So on Saturday of this past week, Pulse MD opened up our first mobile testing facility. Dutchess County and Ulster County, in partnership with Nuvance Healthcare, opened up 2 locations. One at Tech City in Ulster and one at Dutchess Stadium in Fishkill. They're considered regional sites, so folks like me who live in northern Dutchess County will be able to access more easily the site at Tech City in Ulster, and central and southern Dutchess accessing Dutchess Stadium. There's some questions about, will there be more? The short answer is that these testing sites are first approved by the State Department of Health. So there will be only those that are approved by the State Department of Health. And because of the need to manage the quantity and supply of testing kits, those sites are opened as the state feels they can be staffed and they can be operated without problem. The worst would be to open something up and not be able to sustain it. The other is their very specific needs. I mean, these are basically mobile healthcare facilities. So the locations we identified are the most appropriate based on those expectations. I would tell you that as resources become more available, there could be more locations, but right now that is it. And now there's a protocol for accessing those testing sites. If you feel that you're symptomatic and you feel as if that you've contracted COVID and you're starting to see the symptoms and you feel like you need to be tested, first and foremost, I would offer to you that we want folks to somewhat triage themselves. If you're low risk, if you feel like the symptoms are light, not terribly acute, we want you to make the right decisions. You should contact your physician and get direction. They may encourage you to try to weather some of it at home. But if you feel as if you need that test and you are symptomatic, you call your physician. The physician will give you a number that allows you then to take a prescription to that mobile testing site. This is the way it's done in most other locations. It's a matter of managing both the traffic and the test kits to make sure we can get everybody through. And I can only tell you the work that they're doing is selfless. We've been receiving messages, in fact, since the test sites are open. I believe the staff there, the volunteers there, law enforcement, the healthcare providers are all providing great care. We're trying, obviously, to be as sensitive to everyone's individual health concerns as is possible. Before I take the next question, I would offer to you that this is a great time also to say thank you. So we've talked about, I'll let you get set. If you're started ready, here we go. We've talked a lot about sort of the essential businesses, restaurants and grocery stores, pharmacies, truck drivers. I could run the gamut. Healthcare professionals, emergency responders, law enforcement, volunteers in certain not-for-profits, and so many others are really the face of this emergency. They are the emergency responders. The traditional first responders you see, and those that are being called into action in what is an unprecedented public emergency. These are individuals who are taking their own health and certainly their own risks, and they're offering service to our community, and they're trying to provide for our well-being. So if you have a chance, even from a distance, say thanks to the FedEx driver who's moving product, or the truck driver who's helping keep the grocery stores somewhat stocked, the folks who are at the grocery stores, or the nurses that you might see at the hospital or the drive-through testing sites, or that physician that's overwhelmed by phone calls. I know that I thank you on behalf of the people of Dutchess County. I'm tremendously grateful. You are being pulled in so many directions, and we know that this isn't the normal way in which you go about your lives. So you're really giving something selfless and important to Dutchess and to your neighbors, and we're grateful for that. And for those of you who are relying on them, to the extent we can summon that goodwill, I think saying thank you would be the very least we could do for all of them. So we had a question regarding drive-through testing. I talked a little bit about that. A question regarding not-for-profit. Should a not-for-profit organization continue to provide transportation to seniors? I will tell you first, Dutchess Transit, our bus system, has made some changes to the way we provide that service. So we are trying to sustain certain routes for individuals who need regular access to locations. Some are still coming to work, and we're very grateful to riders for practicing social distancing and respecting the drivers. We also have and are operating a point-to-point system, which does allow for certain transportation for seniors and those who need to get to a specific location. DutchessNY.gov, you can get more information. We are asking those who are of good health, who are not symptomatic, who feel comfortable to participate in providing for their own personal protection, latex gloves, medical mask, and otherwise. If you want to volunteer to be helpful, there are still certain not-for-profits that are providing transportation. We're not asking you to put your health at risk. We are, however, asking if you can continue to provide certain aspects of those services. We'll work with you to do that and to minimize the risk that you take on yourself. A lot of questions about The disease itself, I'll talk a little bit about that. I do not pretend to be a doctor, but I've been engaged in this now for 4 or 5 weeks with the public health officials. We're very fortunate that Dutchess County's health commissioner is an infectious disease doctor. Noah Wydian is an expert in his own right, although he wouldn't want to say that himself. Is there a prescription that I can take to cure COVID-19? No, there is not, although there is a lot of testing underway now. As you likely know, both the president and governor have talked about the potential of these miracle drugs. They need to be tested. They need to be used in a way that we can confirm their effectiveness. But as of today, there is not a prescription or drug you can take to cure COVID-19. But there are aggressive efforts in the state of New York to evaluate the efficacy of certain drugs in the hopes of either creating a vaccine that could prevent its transmission or a prescription or drug that could slow the transmission and in essence help individuals overcome that. Are there hot spots in Dutchess County? And the answer is no, there are not hot spots in Dutchess County, but we assume in the way we're functioning is if either you have contracted COVID or you've come into contact with somebody who's contracted COVID. If we function as if we have contracted the disease, we'll make decisions that limit the transmission. But there is not an identified, if you will, hotspot. I will tell you, however, the epidemiologists and the staff at the Dutchess County Department of Behavioral and Community Health monitor the data all day long. And by identifying who's been tested and where the positive cases are, they monitor for the potential of an emerging hotspot or the existence of a hotspot, and we would want to respond to that. And we do that in concert with the New York State Department of Health and the governor's office. So if there was a situation where we saw that growing, we would know it before it happens. We would evaluate and prepare for it, and we take steps to minimize it. But that also is really dependent. Whether or not we have that kind of growth is dependent on whether or not we're all engaged in the social distancing and limiting that transmission by staying home. And not interacting in social gatherings. That will be really key. Excuse me. I want to question a couple questions regarding county parks. First, Dutchess County only has 2 parks that have playgrounds in them. So we have asked and encouraged people to make use of Bowdoin Park, Wilcox Park, and our rail trails, the Harlem Valley and the Dutchess Rail Trail, but to engage in physical distancing. And so I've seen even families on their own right, 6 feet apart, walking the rail trail. That's appropriate, and we want people to have access to some of those resources. Playground use is just not, and we were monitoring that activity over the course of the last week. I will tell you that playground use has diminished significantly. But in order to ensure that families, and I know that I'm hopeful some moms will appreciate this, when you take the kids to Bowdoin Park and you want to walk the trails and maybe look for the eagles that happen to perch there, and those playgrounds are accessible, I know that they're an attractive nuisance. It'd be hard pressed to keep my kids from running off onto the playground. So you will see that Dutchess County playgrounds are going to be fenced off. There'll be orange or green snow fencing to fence them off. It's not what we want to do, but it's necessary in order to make it easier for you to enjoy the rest of that space, to engage in the social distancing, and to obviously make sure that we're not transmitting the disease. So even though use has been dramatically reduced, county parks will remain open, but the playgrounds will close and we'll fence them off so that there is not that encouragement. Just bear with me as I get through some of these questions. Again, so this is a Facebook Live Town Hall. I think that Facebook is working pretty well. I'm told that Netflix is not. So since Netflix isn't working, I may be the most exciting thing on television at the moment. Probably not. That's not true. But if you're with us, feel free to post a question in the comments. We're going to get through as many more as we can. But I do want to tell you that so every Wednesday we will have a live activity of some point, some fashion to give you updated. So whether it's Facebook Live in this case or a telephone town hall, there'll be that live opportunity. So next week is next week April 1st? I think it is. So next week, however, we're going to be on Thursday, April the 2nd. So Thursday, April 2nd will be our next live event. It'll be a telephone town hall, and a live Facebook feed, and allow you to ask questions, and we'll talk directly over the phone and through social media. And then every Wednesday there will be a live activity. Every day, by 7 p.m. every day at Dutchess County's Facebook page and Twitter feed, there is a recorded update. So you'll get some video update of what activities have been going on, some new information we want to share. And if you follow us at Dutchess County Government on Facebook or Twitter, you'll get timely and regular updates throughout the day, including we share with you the live feed of Governor Cuomo's press conferences. Very informative, very important. We're all talking in the same way and using and sharing the same information. So Dutchess County's Facebook page is the place to go for that. What are you doing about small businesses that have shut down? Excellent question. First, Dutchess County was one of only three counties in New York to qualify for Small Business Administration loans. Now, some small businesses are saying, listen, I can't afford to pay it back. The truth of the matter is, if you were trying to support your employees and could qualify for the SBA loan, you should take advantage of it. At the very least, it'll defer payments, and you can save some of what you have. I also expect that there will be further federal action to look at those SBA loans and create a greater opportunity for small businesses to minimize the losses. That said, we have never seen anything like this. I mean, certainly not since the Great Depression, and that was a sort of a different financial crisis. This is going to hurt Main Street and small businesses for a long time. And I know the anxiety and the burden that many small business owners face. I took an opportunity to stop and talk to a couple from a distance, and I just know that they're not sure that they'll ever open again. And I know that stress that you feel and a challenge that you have. So we want you to know we're doing everything in our power to get assistance to help small businesses. So the Small Business Administration loans were announced last week. You should visit dutchessny.gov to get more information. If you are a small business person, whether you are the sole proprietor or you have employees, visit dutchessbnn.com. dutchessbnn.com. That's Dutchess Business Network. Dutchess Business Notification Network.com. dutchessbnn.com. Sign up. We have a notification structure organized by the business community and Dutchess's economic development apparatus, or economic development structure, where we're providing daily updates to now 8,000 business people across the county. If you've not signed up yet, you should. You'll get daily updates and information. So you may be, in the same line of questioning, heard today that late last night the President, the House of Representatives, and the United States Senate came together on an agreement for what you might read as a stimulus package or recovery. I call it a lifeline. It will not be sufficient, and it is not going to be enough to assist, but it is an immediate lifeline that the federal government has agreed to. It's a $2 trillion package. We do have it is a bipartisan negotiated deal, so both houses, both parties have agreed to it. The President has signaled he would sign it once adopted. The Senate, I think, adopted it late last night. The House of Representatives is likely to adopt it today or tomorrow, and then the President would sign it. Governor Cuomo has expressed some concern that only about $3.8 billion of that $2 trillion would be directed to the state of New York. If you visit, we're going to try to have a summary of what we know is in that bill. Hopefully later today, we're going to share that with supervisors and mayors in Dutchess County tomorrow. And then hopefully tomorrow we'll have some updated information as to the details of what's in that legislation. But that's what we know so far. There is support for individuals and families. I think families and individuals of $99,000 or less will receive some direct assistance. And then there is small business aid. There is aid to the the hospitals and healthcare providers. And there is aid to municipalities. This is just going to be a monstrous effort to manage through this time, but then to recover. I will tell you that last Friday I asked Assistant County Executive Ron Hicks, who oversees our economic development efforts, to begin a plan to rebound. And I know that that sounds both impossible to conceive and almost foreign right now, but we are working with the business community. We're conducting a survey of businesses to identify what they believe, each of you believes is the current impact, what you think the long-term impact is, and what are the things that you're going to need to get back on your feet, whether it is access to dollars or perhaps it's some regulatory relief. And we're going to create a package and a set of steps that we want towns, villages, and cities to try to implement, we'll try to implement, and we'll advocate at the state and federal level in hopes of trying to make it easier for us to rebound when we start to return to some semblance of normal. So let's get a few more questions in. We've talked a little bit about, I know this question regarding precautions for essential workers. Again, what our public health professionals say is if you're an essential worker and you have access to a basic medical mask, that is useful, that is important. Obviously, washing your hands. This is very useful, and using the hand sanitizer frequently is useful. But just as effective and as important is just simply washing your hands with traditional hand soap. So if you're going to work at the grocery store, if you're at a pharmacy, or you're providing some other essential work in the community, wash your hands as frequently as possible. You probably know this and have heard it so much. Washing your hands for 20 seconds or more is the safest approach. And it is in fact that friction that we make when we wash our hands that helps to kill the bacteria. Washing your hands, certainly trying to cover your mouth, taking these personal steps to cough or sneeze into your arm. And then I will tell you what our professionals tell us and what my wife expects. And that is, when you come home, change your clothes. Take your outer clothes, get them into the laundry, and change your clothes. We don't know a lot about the transmission of the disease. We know that it can stay on soft and flat surfaces. And so the best approach is, to the extent you can, take those clothes off. I can't believe I'm encouraging you to do this, but nevertheless, and get them washed and put on a different set of clothes at home. Those are some of the steps we can all take to minimize transmission. Of course, even in our own houses, to the extent that we can, be cognizant of personal hygiene, making sure that the kids are bathed, and we're all kind of taking those steps. And even at home, socially distance ourselves, especially if you're a worker coming home, just to be sure that we're not transmitting the disease as we can. We also know this, that some people can. We do know that the disease, and they'll correct me if I'm wrong, that it can be transmitted without symptoms, but we do know that symptoms begin to appear between 7 and 14 days of I did it wrong, 2 and 14 days from contact. So within 2 and as many as 14 days, if you've contracted the disease, you might start to see symptoms. Now understand, those symptoms are different for everyone to some extent, but headache, low fever, right, sore throat. Some have experienced, certainly because it's a upper respiratory illness, you might receive experience shortness of breath, coughing. Some have actually reported a loss of smell. These are kinds of things and taste. These are the things you want to be aware of. And again, it is likely that if you've contracted it, you'll start to see those symptoms between 2 and 14 days from that interaction. A lot of questions regarding rent. I will tell you that the federal government and the state government have attempted to take steps to assist with a mortgage payment relief and loans and student loans, and that information you can find online. Visit duchessny.gov. Not a specific action for rent payers. I would offer to you that you should speak to landlords in the hope that they will obviously understand if you don't have the income. I will tell you that the courts are not entertaining evictions. So the fact of the matter is that working out a relationship with your landlord right now is the best option. But I also will let you know that the state legislature, the New York State Legislature, is considering a bill that would provide somewhere between 30 and 90 days relief on rent. But again, we're hopeful that landlords who can afford to make these decisions will work with you, and as a tenant, you'll have those conversations. And I'd be honest, if you have a change in your income status or you've suddenly become unemployed, at this point, obviously, we want to keep people at home, and we want to be respectful of the fact that there just isn't the income to necessarily make some of those payments. So I can't give you that there's a direct government action, but the state legislature is considering some relief, and we'll provide you some update when that happens. Some folks again asking about schools, school closures. I would offer again that Ulster, Orange, and Dutchess made the decision to move forward with school closures. We expected that to continue at least till April 1st. Governor Cuomo took action, as you know, statewide. While there has not yet been a decision and to announce, I would expect schools to remain closed for the month of April. And if you look at the transmission trajectory, the expectation is that we are going to be living in this sort of restrictive environment for as few as 4 to as many as 12 more weeks, and that's the world. That's a trajectory that the federal and state government's looking at, all based on this rate of transmission. So I would at least prepare at this point for not to return to school in April, and we'll give you more information as that becomes available. A lot of questions regarding hospital supplies. Again, I want to tell you that accessing personal protective equipment is challenging, and I think I said this only moments ago. This may be the soft underbelly of the American public health response system, and that is that these products were not stockpiled appropriately for this kind of epidemic, and a pandemic, and the supply chains are very challenged. So. Again, if you're a business or an individual who has access to personal protective equipment that you're not going to be using, there'll be opportunities for you to donate those supplies. Dutchess County, along with the state of New York, are making purchases in order to get those products to healthcare providers and professionals. It is limited, and the access is limited. I said before, Commissioner Dana Smith, our Department of Emergency Response Commissioner, is actually driving to Connecticut to purchase product right off the boat. That we had to validate and verify and bring it here. So again, if you have product you want to donate, visit dutchessny.gov. There'll also be some drive-up opportunities for that to happen later in the week, perhaps the weekend. We'll keep you posted on that as well. So a couple questions about the status at our hospitals. A couple things. We have regular conference calls with our hospital leadership. And in Dutchess, of course, that's Northern Dutchess Hospital, that's Mid-Hudson Regional, that is Vassar Medical Center. And of course, we have a relationship with the hospital in Putnam County and the hospital in Sharon, Connecticut. We have regular updates as to their census, meaning the total numbers that they have versus their capacity. They have suspended, I think in almost every case, elective surgeries. So that they've created capacity on site. The governor, as a response to the needs in New York City, has begun the process of opening alternative care facilities in New York City, and we are in the process of opening one here in Dutchess County. So we are converting with the leadership at Dutchess Community College, the dormitories there, very specific needs. I had some questions earlier about why the dormitories? Well, keep in mind that dorms themselves function almost like hospitals to begin with. They have the food service capacity, they have the office space, they have the medical stations, and they have individual rooms. And that's necessary with a pandemic like this. So all of the hospitals are working with Dutchess County. That effort is being led by our Assistant Commissioner for Behavioral and Community Health, Kathy Tetmeyer. We have organized that team. They're now beginning to the process to work out the logistics and then convert that dormitory into an alternative care facility. Keeping in mind the goal here, right, is to have the more acute care at the hospitals, and those with less severe symptoms would be provided service at this alternate care facility. We can house as many as an additional 500, actually 600 on that campus. Thanks to President Elizabeth Bradley at Vassar College, we're able then to use Vassar College dorms as another site. And to his credit, and again, these are the ones we've asked. Dr. Dennis Murray at Marist College is providing that as well. So First, it's monitoring capacity. We expect that within 2 weeks, we're going to need alternative capacity. That'll be Dutchess Community College. If we grow beyond that capacity, it'll be Vassar. And then we're also working with towns, villages, and cities, not for medical sheltering, but in communities to ensure that if this is a long-term event, which it could be, longer than even some have expected, we want to be sure that there's non-medical sheltering, and organizations all across Dutchess have volunteered, from Catholic schools to some of our not-for-profits to the Dutchess County Fairgrounds, all volunteered to be of some help to us. How are people staying safe in grocery stores? Well, social distancing is necessary, no matter what store you're in. And I will tell you, I drove by a convenience store that I did call when I got in today. Socializing and gathering in those locations is not healthy. It is not healthy, and because of the demand that is going to be placed on the healthcare system, it is also dangerous. We just don't have the ability to hospitalize, of course, and care for every person at once. So the slowing of that transmission is critical. Social distancing, physical distancing in those spaces. If you are working in an essential space, again, we hope that you can get access to a medical mask. If you can't, we ask people obviously to take those personal hygiene steps, whether you're working there or shopping there. Most of our grocery stores have created opportunities for higher risk people to shop in the morning, or shop at alternate hours. Visit dutchessny.gov for more of that information. Is there a travel ban in Dutchess County or a curfew? I mean, the short answer is no, but if you don't have to travel, don't travel. I mean, the message that we offer people is do what is necessary when it is necessary. But if it isn't necessary to go off to the grocery store or to drive off to a location, then I'm sorry, to the extent you can, please stay at home. Enjoy the time you have with your family. Enjoy the time maybe in the yard, walk your block, even shout across the street and talk to your neighbors. But again, there's not a travel ban, but we are asking people to stay at home and try to slow that transmission. And certainly it makes no sense to travel outside of the area, travel outside of the state, or travel to some other location. It just doesn't make sense to do that for the time being. Until we see the transmission rates slow, the numbers of those who have contracted COVID plateau and start to incrementally decrease, we all have to do our best to stay put. And so to the extent you could encourage that, that would be helpful. We're getting very close to 3 o'clock. This was an hour long. If there are more questions, please post them. You've been on this live telephone town hall. If there are questions that we didn't get to address, visit dutchessny.gov. There's information there. Click on the coronavirus tab. Click on the Dutchess Responds tab if you'd like to volunteer or donate your time or resources. We really encourage you to be a part of that effort. If you have a specific question that you would like to still have answered, you can call 845-486-3555. That's 845-486-3555. Now we're going to have another live event next Thursday, April the 2nd, a live telephone town hall and Facebook Live town hall. That'll be on April the 2nd, and then every Wednesday thereafter, you'll see us live either simply on Facebook or through a telephone town hall and Facebook, and you'll be able to participate in that as well. Let me say to you again, if you want to get involved and you want to volunteer, there are opportunities for you to do that. dutchessny.gov is the place to start. Go to the Dutchess Responds tab. You'll be able to sign up to participate. If you're a small business owner or a business person and you would like to get more information about the activities and the information that we're sharing and the support that will come your way, you want to visit dutchessbnn.com, Dutchess Business Notification Network, so dutchessbnn.com. Sign up for that. Over 8,000 businesses signed up for our regular notification, daily notification to all of you. It's a good opportunity to remind folks that this, we recognize, is unprecedented. It is a very stressful and anxious time. And I understand, believe me, the stress that's being built up on business people, on first responders, on essential workers, on those who are out of work now, substantial unemployment, families who are having to reorganize their whole lives to provide some semblance of normalcy to your kids. Dutchess County's Department of Behavioral and Community Health has a lot of resources available to you. One of them is our helpline, 845-485-9700, 845-485-9700. That is if you are dealing with emotional or mental health stress, that there are professionals available to you. If you are in crisis, our stabilization center, through that phone call, will be able to provide you some assistance. We are expanding access to those who are living with addiction to be able to access medication-assisted treatment, trying to do that in partnership with a few providers, and that'll expand over time. If you're dealing with some significant emotional or mental health stress, 845-485-9700. On April the 2nd, when we have our telephone town hall, that happens to be International Autism Awareness Day. We're going to spend some time during that telephone town hall talking a little bit about some tools that you can use to provide assistance if you have a family member who is living with a developmental or intellectual disability, if you have a family member who's living on the autism spectrum, and we'll try to give you some guidance on things that you might be able to do and services that you might be able to take advantage of. I would encourage you to take advantage of all of these online tools that we have. Many of our libraries have online services. Certainly the Mid-Hudson Library Association has access to online services. It's amazing. Somebody posted the other day that it turns out the library system has access to books. Well, that's what libraries are, and taking advantage of both the digital and the online options is a great opportunity. If you're doing something that has to do with literacy or any access or use of our libraries, and you want to post it online, include a hashtag Dutchess Reads. It's a good reminder that there are those tools available. If you visit our Facebook and Twitter feeds, Dutchess County Government, you'll see regular updates not only about coronavirus, but some things that might provide you either entertainment or resources that you can use. And if your voice is strained and you don't want to read your own kids, every couple of days I'm reading a book, so you can take advantage of that. It's a little help I can offer in your own house. Those are all resources that are available to you, and we want to be there for you. Again, this is a great opportunity to remind you to visit dutchessny.gov if you have more questions. We're going to come to you live again on April the 2nd, and I offer this to you. I absolutely, we all do recognize that this is just unprecedented, and we're living in a very stressful and uncertain time. I know that the countless volunteers and healthcare professionals and emergency responders and our new emergency responders, those essential workers, you're all doing amazing work, and you're being asked to be pulled, and you're being pulled in so many directions. And I can't imagine the stress and the pressure, but I can tell you that we are here for you, that we want to be helpful to you, that we're praying for you, and we're grateful to you. So whether you're responding to a hospital, or you're at one of our mobile sites, or you're driving product from grocery store to grocery store, or you're working in those stores or providing care to people who are in need, we are grateful to you. Dutchess County appreciates you. And I know that you have it within yourselves to do this. And to everyone else, as challenging as this is, and the devastation and the burden is going to be real for a long time, please know that we're with you, that we are all in this together. And we will use every tool and every resource we have to be of help to you. And we want each other. If we can't physically, at least we can emotionally lean on one another. So use the technology, use the tools, and rely on us to communicate with one another, to show our support for one another, and to help summon the strength and the hope that together we are not only rising to this occasion, but we will weather the storm. And with that, I look forward to talking with you on April the 2nd during a live event that we'll hold. And stay here at Dutchess County Government on Facebook and Twitter for regular information, and visit dutchessny.gov for more help.